Welcome everyone to Grand Rounds. I think a few more people may be joining us, but we're here today to talk about Connecticut medical marijuana program, and we have Eric Halpern, PharmD, to present. So we're very excited to have him. He is home. He's got some young children. He did make some concessions to be here, so we're really happy that he's able to attend. And I'll turn it over to you, Dr. Halpern.
Right on. Thank you for that introduction, and looking forward to talking to you all. And I'm going to make sure to have the chat screen open while I talk. And I would love if you ask questions as we go. I'm that kind of presenter. I'd love to answer them when it's most relevant, because if we wait till the end, I'm sure we'll forget them by then. So feel free to ask questions in that chat box, and I'll answer them as we go. All right. So I am the Actually, is the chat box covering the slides? Or are you still perfect on your end?
We're good.
All right, awesome. So I'm the assistant dispensary manager in Newington, Connecticut for Fine Fettle. We're a very small multi-state operator, mostly in New England. We have 3 medical marijuana dispensaries in Connecticut, 2 recreational and medical dispensaries in Massachusetts, and 2 cultivations in Massachusetts. We also do a little bit in Rhode Island and are very soon growing into Georgia, which is the next state that will be standing up their medical marijuana program and have pharmacists involved, which we love to see. It's very rare around the country in the almost 40 now states that have medical marijuana programs to have healthcare providers involved in the program beyond the certification step. So it's really been an interesting opportunity for me, having worked in the retail setting for about 12 years, mostly with Walgreens and then a small independent pharmacy and a stop and shop grocery chain for a short amount of time. And now have been with Fine Fettle for about 2.5 years now. We opened in September of 2019. We were open for about 6 months and COVID hit. And we had to really figure out how to smoothly run our operation with all the safety guidelines in place and making sure our patients were taken care of, as we were deemed an essential business by the state of Connecticut. I'm also very involved in the Connecticut Pharmacist Association. I'm on the board of directors and have been for a fair amount of years. And it's a great organization for pharmacists to connect, and especially because I'm the only pharmacist on the board of directors who works in the program, I'm been really able to share my perspective as a pharmacist in the program with the greater pharmacist population in general in the state. So the program in Connecticut was started and the legislation was passed in May of 2012. This was not something I learned about in school. I maybe had about 30 minutes of education on cannabis in school, and it was looped into the same conversation with substances like psilocybin or mushrooms, MDMA. It was not something that was being presented as a medical compound, as something that was being presented as a Schedule I substance, the highest classification of scheduling that the DEA does, meaning that there is no benefit with medical applications, and it's really just a harmful substance to society. So at that time, it was really big that Connecticut had just passed this legislation the same month that I graduated. And in May, and then in 2014 is when the first 6 dispensaries opened across Connecticut. Connecticut was the first state to involve pharmacists and pharmacy technicians in the process. They took the pharmacy laws and regulations, essentially took out the word medication, inserted the word marijuana, and the dispensaries are run very similar to retail pharmacies. They cannot be open without a licensed pharmacist present. Medical marijuana can only be dispensed by a licensed pharmacist. And what I mean by that is not the act of actually selling it at the register, but the packaging of product to be dispensed. So we aren't packaging large bulk containers into small containers. Everything is coming from the grower's pre-packaged unit of use is the term we would use in pharmacy, where we're really just putting a patient-specific sticker on the product. We don't have to count anything, weigh anything. We're not baking anything. It's honestly much more streamlined than a typical pharmacy where you're stocking tons and tons of stock bottles and packaging different quantities for patients. Beside us in the dispensary, only Connecticut licensed pharmacy technicians can work as dispensary technicians. What that means is the only people who are going to be handling product in our facility are licensed pharmacists and technicians. This was very dissimilar to other states where a bud tender does not have to have any sort of traditional healthcare background or training. Connecticut did it different here by keeping it the staff that would have been running a pharmacy. Now we're running dispensaries. In the state of Connecticut, when this legislation passed, it protects patients from state criminal and civil penalties. But because it is a federally class 1 drug still, according to the DEA's classification, patients technically are not protected from federal criminal and civil penalties. To my knowledge, that hasn't been an issue in Connecticut, and I haven't read anything of it being an issue in other states. But that is a sort of a barrier for some patients or for some residents to become a patient, is their fear of what could I be liable for consuming a federally illegal substance. With Connecticut, and in the beginning, there were only 6 licensed dispensaries. Now there's 18, and products can only be sold from these licensed dispensaries. So it's not like a typical pharmacy is able to stock these products. We actually in the dispensary operate under a very different licensing structure. So we can't purchase typical medications, and a typical pharmacy can't purchase medical marijuana to sell. These are the current statistics as of last week. There's about just over 50,000 registered patients in the program, and about 1,500 registered physicians or certifiers and 18 licensed dispensaries. So even going from the original 6 dispensaries in 2014 to 18 now, it still is not a very large program in terms of the amount of dispensaries. Other states will have hundreds of dispensaries across their state. Connecticut has still kept this a very tight-knit program, and the licenses that are given are through a application process. It's not like a typical small business where you can get the zoning, get the funding, and pay for a license. It had to go through the state's application process, which they had 3 different rounds of during the course of this program. And like I said, our first dispensary was in Willimantic. We then opened in Newington a few months later. And recently, we were able to acquire a license and open in Stamford to add another dispensary to Fairfield County. This is the list of approved conditions for treatment with medical marijuana. In Connecticut, only patients with a certain qualifying condition are able and eligible to get a card. In some other states, such as Massachusetts, it's up to the medical provider. If they feel a patient could benefit from medical marijuana, they could certify any patient. In Connecticut, we are confined to this list. The list is managed by a board of physicians that has approved every single one of these conditions. Technically, through legislation, conditions could be added to the program, but that hasn't happened as of yet. And I don't believe it would happen. This seems the common pathway for a condition to be added is patients or residents rather can petition to the state with their qualifying condition, attach evidence of how it has improved their quality of life or symptom relief. And then the Board of Physicians evaluates the literature that's out there and chooses to approve or deny that condition. Up until actually still PTSD is the only mental health condition on this list. Anxiety and depression on their own are not qualifying conditions. They specifically have to meet PTSD criteria. And PTSD is still the condition that the majority of our patients are certified with. After that would be cancer. And now that chronic pain was added in 2020, we have a lot of patients who have chronic pain as their qualifying condition. Chronic pain being added in 2020 was huge for the program because up to that point, only patients with more specific rare conditions that had pain associated with them were eligible for a card. But now anyone who's had chronic pain for at least 6 months duration, refractory to other treatment, and that isn't specified what that has to be, are eligible for a medical marijuana card in Connecticut. And there are a handful of pediatric conditions. I am not aware of a total number of pediatric patients in Connecticut. In our store, we have one patient who gets CBD to prevent seizures, but that is much more rare in this program to have patients coming in who are under 18. And there is specific language in the legislation that prohibits these patients from ever being dispensed an inhalable product. So the steps for becoming a patient are pretty straightforward. The patient who has one of these qualifying conditions that were listed on these previous slides visits a certifier, and once COVID hit, telehealth has become the mainstay of these visits. It used to be an in-person visit and a physical exam was required. The state took back that requirement once COVID hit and hasn't put it back into place. So a lot of patients are able to have a telehealth visit, discuss their qualifying condition with a certifying either MD, DO, APRN, and now PAs will be able to do this. In that, medical provider registers the patient online in a website called BizNet, documenting their information, qualifying condition, and attesting that they conducted this visit with the patient. And at that point in time, the patient registers online, providing proof of Connecticut residency, because you do need to be a Connecticut resident to have a Connecticut medical marijuana card, proof of identity. Most people use a driver's license, and then $100 to the state. It is an annual recertification process. So every year, patients until this point pay $100, but with the adult use legislation coming down the line, there is discussion of the $100 requirement being taken away. So patients would be able to get recertified for free and just owe whatever the provider wants them to pay for their appointment. On the other side, for the physician to certify the patient, they visit BizNet, the state's website that manages these certifications, and types in their DEA number. The person certifying has to have an active DEA license, active state and federal controlled substance registration, and BizNet is basically on the back end checking that information when the provider puts in their licensing information. Once that goes through, which is instantaneous, the provider is able to enter in all that patient information to make sure that the right patient with the right address, phone number, email is getting certified. There is no continuing education requirement for certifiers at this point in time. And that goes the same for pharmacists as well. So in Connecticut, most certifiers aren't having a lot of consultation with the patient about products or dosing regimens that they recommend. It's really on us as the pharmacist to provide that information. In other states, such as Pennsylvania, they do have a 4-hour certification course that providers are required to take. Connecticut hasn't set up anything like that at this point in time. The two main components that we look at in cannabis are THC and CBD. CBD has become a huge topic of discussion since 2018. The Farm Bill allowed retailers to sell CBD products, allowed agricultural companies to grow CBD, grow hemp rather, and all hemp is, it's the cannabis plant with less than 0.3% THC. So if you had a hemp flower and a cannabis flower and you looked at them and smelled them, they appear the same, they smell the same. It really comes down to this lab analysis showing that the hemp plant is not containing any appreciable amount of THC. CBD on its own is not intoxicating. It does not have the same psychoactive effects as THC. You can actually eliminate some of THC's unpleasant adverse effects. So there definitely is a place for CBD in the medical marijuana program, but since it became legal in 2018, the growers in Connecticut do not produce a large amount of products containing just CBD or even in combination with THC. And so this is something that we're constantly talking about with our patients, is if we aren't able to acquire a product that they're looking for because of the limitations of us only being able to order from the 4 licensed producers, we'll have a conversation about where else they could access products. The issue with CBD is it's not regulated by the FDA. So the products out on the shelves may be out there without any sort of lab testing for things like heavy metals, pesticides, fungus, things that just happen with the plant and the growing process. So we're always advising patients to look for products with what's called a COA, Certificate of Analysis, showing that the product is safe to consume and contains the amount of CBD as advertised. On the other hand, THC is the most common cannabinoid and the main psychoactive component of cannabis. This is what provides the euphoric effects, sedation, stimulation, depending on the strain. it is what makes cannabis federally illegal at this point in time. Delta 9 THC is the psychoactive form that you get when you combust or vaporize the plant. And Delta 8 THC is something you may have heard of, and there's a lot of confusion about. Because you can actually convert CBD to Delta 8 THC, which is almost half as psychoactive as Delta 9, there are now over-the-counter products containing Delta 8 THC. Because if they make it from hemp-derived CBD, it's in this gray area where the FDA isn't tightly regulating it. Some states and markets have taken the initiative to ban these products from dispensaries and retailers, but anyone who goes online would be able to find these things and have them shipped to their home. So it's a really scary thing out there because Delta 8 THC is truly psychoactive. And if there is someone who doesn't know what they're consuming, it could be very dangerous. THC has been studied for anti-inflammatory, analgesic effects, increasing appetite. And essentially all the products we have come down to where the THC is extracted from, what type of strain, and what dosage. There are certainly adverse effects associated with THC, the most common, which I didn't list here, being dry mouth or xerostomia. So that would be a point of conversation with a patient, especially if they're new to cannabis, to expect the adverse effect and how to manage that side effect. And really keeping the dosage low is the best way to avoid the side effect. Some patients may experience panic. They may experience anxiety, paranoia. There are a lot of psychological side effects that can happen with THC, which is why we're always recommending patients start low and go slow to try to find the minimum effective dosage where they get symptom relief without experiencing these side effects. If they do experience them, we recommend patients have CBD at home because if you use enough of it, it can actually reduce those psychoactive effects of THC. This is an acronym of Pharmacist put together of the different functions of the endocannabinoid system, which is what THC and CBD interact with. So preface, PREFS, protect, relax, eat, forget, sleep. The endocannabinoid system is mostly located in the central nervous system and the immune system, but our skin also has these receptors as well. So this is just a really nice, I think, breakdown of what the endocannabinoid system does with its naturally existing endocannabinoids. What I mean by that is 2-AG and anandamide are two endocannabinoids that naturally exist in our bodies and interact with this system on a daily basis. The way that they interact with our system does not produce psychoactive effects. It's not like someone is feeling euphoria or intoxication just by having this, but it's what partially activates the system. THC, on the other hand, is a very strong agonist at the CB1 receptor and is how it provides the psychoactive effects. CBD, on the other hand, does not strongly interact with the CB1 receptor. It actually can kick out THC if it binds, and that's why it does not have those psychoactive effects. After cannabinoids, terpenes are another important component of the plant. And this isn't something that's unique to cannabis. This is something that exists in all different plant matter. Significant terpenes that we look at in our labels in Connecticut are myrcene, beta-caryophyllene, linalool, pinene, humulene. These all have potential effects for our patients. So for example, if a patient's looking for sedation or pain relief, we may encourage a strain that's higher in myrcene, which is also present in mangoes. If they're looking for anti-inflammatory effects, we'll look at strains that are higher in beta-caryophyllene and humulene. This isn't something that's extremely well studied. We unfortunately don't know if X percentage of one of these terpenes will have XYZ effects, but it allows us to at least utilize some sort of scientific knowledge to recommend one strain over another. And as pharmacists, that's what the patient is depending on us for. Again, the provider is certifying the patient for a monthly allotment of medical marijuana, but they're not prescribing or recommending any specific products or dosages. And as pharmacists, we are recommending these things, but in the end, patients can purchase anything that's on our menu. Every patient has the legal capability of purchasing any product that they're choosing and using it however they see fit, but we're here to help guide them along the way. Patients who are new to the program get a consultation with us. We're able to review all this information, review their health conditions, review their symptoms that they're looking to improve, their lifestyle, any existing preferences, such as no inhalation, for example. And we go through all of this to put together something that fits their budget and their lifestyle. On any cannabis menu that you look at across the country, strains are labeled with either sativa, indica, and hybrid. This is more based on the physical structure of the plant, but it's the best way we have at the moment to categorize different strains of cannabis into excuse me, different potential effects. Excuse me. So this is all the same plant. Cannabis sativa is the genus, I believe, is the correct term, but there are thousands, if not more, individual strains out there that can have different effects. Sativa strains tend to be more stimulating, uplifting, energizing. So most people use this for daytime. So someone may be looking for an antidepressant or anti-anxiety effect with the strain type. Someone who's looking for motivation. People say they'll use this and then clean their house for 2 hours. It's something that people who are already prone to anxiety, though, we recommend avoiding because it is more likely to worsen anxiety than the other strain types. Indica is the opposite. We say indica couch. It provides a much stronger sense of sedation, pain relief, relaxation. Patients are typically looking for this in the excuse me, evening and bedtime. We have a lot of patients who really only use this for sleep. No matter what their qualifying condition, I say sleep, pain, anxiety are the 3 symptoms we talk the most about. And a lot of patients are only comfortable using this at bedtime. So that way, if they are experiencing psychoactive effects, they're not really going through the day with that. It's really just happening while they're sleeping and hopefully helping them stay asleep. A hybrid is a product or a strain rather that doesn't clearly fit into the sativa or indica category. It could be labeled sativa dominant, it could be labeled indica dominant, or neither. It doesn't really mean anything because someone could have sativa-like effects with a hybrid. Another person could consume that and have more indica type effects. So while we feel sativa and indica are more indicative of the potential effects, hybrids are really hard to dig into and understand the potential effects. In Connecticut, the growers are forced by the state to use product naming that is not the same as the legacy or the street name of a cannabis strain. So in any other menu in any other state in the country, you'll see the same strain names, such as Girl Scout cookies or lemon skunk. There's a bunch of different crazy and honestly wild names out there, and a lot of that has to do with the original breeders of these strains. It's what they came up with. In Connecticut, the growers, for various different reasons, wanted to avoid using that nomenclature. So strains in Connecticut have to be translated by us as a dispensary staff to our patients if they're looking to know how to Google, for example, one of these strains. There are websites out there that provide information on cannabis, where a patient could type in the name of a strain, read about what some people use it for, what the smell and aroma may be, what the flavor may be. People even leave like comments or reviews, you could say, on the products. But in Connecticut, it doesn't link up with any of that because of this different naming system. Everything is independently tested by a third-party lab before it gets shipped to the dispensary, and that's every single batch of product. So this is more regulated than an FDA prescription drug. With the regulations, the product has to be randomly sampled from the grow operation, from the licensed producer, transported to the lab, and then all this testing has to be done before it ever gets to us to the dispensary level. So it's being tested for the active ingredients, which are the cannabinoids, THC and CBD being the main ones. And the reason it says THC and THCA is THCA is the acid form of THC, and it's how it naturally exists in the flower. So if someone were to find a cannabis plant growing and take off a flower, it does not actually have any psychoactive effects in that state. Its heat is what you need to decarboxylate that THCA to THC, delta 9 THC specifically, which is the psychoactive component. So that's a misconception that if someone were to find the flower and ingest it, that it would be very, very dangerous in terms of an overdosage of THC, but it's not in THC, it's not in the active psychoactive form at that point in time. Below, THC and CBD are other more minor cannabinoids that are more extensively being studied, but to be honest, there's a lot to learn. CBN is one that's become more popular for its thoughts on helping with sleep, CBG on inflammation, but there's so much to learn here. And honestly, the market cannabis across the country isn't huge on there isn't a high demand for these more minor cannabinoids, but I think as the next 10 years go on, we'll see products come out that are only these minor cannabinoids, and people are going to figure out how to use them. They also are going to be packaged with an expiration date, which is always for most products, 1 year from the packaging date. It's not that the flower is bad or the flower is necessarily dangerous for use, but the state just put a strict guideline that a year is the longest period out that a product can be said to expire. The quickest expiring products are edibles, such as baked goods, brownies, cookies. That's because of the food ingredients becoming expired after more of a 30 to 60-day period. Then we have the terpenes that we discussed. These are always going to be broken down in percentages. And so we can look at what the terpene profile is of a strain and try to predict what its additional medical benefits could be. And then it's tested to make sure that nothing unsafe is in there, such as microbiology, mycotoxins, heavy metals, pesticides. Mold is something that has been heavily discussed in Connecticut, and there's certain thresholds of mold that are natural to exist in the plant. There's certain types of mold that are considered safe and some that are considered unsafe. And that's something that's been coming out the past year and a half or so about how the third-party labs evaluate this mold, what kind of mold they're testing for, what kind of thresholds are considered pass or fail. And that's still a huge topic for discussion and investigation. So in a consultation with a patient, we are talking about their diagnosis, their health conditions, prescription medications, and this is all information we collect from them, doing a digital intake, patient intake form. Symptoms they're looking to improve, cannabis experience preferences. Their certifying diagnosis is their key to get into the program, but it's not the main focus of our conversations with our patients. We're really focused on what symptoms are troubling them the most and what they're looking to relieve with medical marijuana. That's our goal. So there's no one size fits all. It's not like every PTSD patient gets XYZ products and every cancer patient is going to get XYZ products. Very different from traditional medicine. Patients could use all of our products in different ways, and we're providing on a trial and error basis products and trying to achieve symptom relief. The route of administration is very important with medical marijuana, and inhalation or smoking is by far the most popular. It's what people have done forever. The traditional raw flower is the most cost-effective way to use medical marijuana on a $1 per milligram basis. There's also extracted vape oils, which I'll show you on the next slide. Another route would be anything that's swallowed and goes through the GI tract, such as capsules, tablets, edibles. Then there's sublingual, which is going to avoid the GI tract and avoid first pass metabolism, going right from the oral mucosa into the bloodstream. And this is most commonly achieved with oil-based oral solutions or sublingual sprays. And then there's topical. So our skin has the same CB1 and CB2 receptors as the rest of our body, but this is something that may provide relief without systemic effects because it's not being absorbed in any significant amounts from the skin into the bloodstream. And in Connecticut, the products may be just THC, which would be the majority of products, just CBD, very much the minority of products, and then a handful of products that contain both cannabinoids, THC and CBD. And the benefit to those is you can potentially get symptom relief without psychoactive effects. The thought is if you have a 10-to-1 ratio of CBD to THC, it's enough to negate THC's strong agonist activity at CB1 and have enough activity of CBD to allow THC to have some analgesic, anti-inflammatory, anti-anxiety effects without experiencing true intoxicating effects. But that's very much still individual to each patient. So there's really no knowing 100% what ratio will have a patient get relief without feeling psychoactive effects, which is why we always say, please be at home in a safe, comfortable space, have water available, just so when they're using these products and finding out how they affect them, they're in a safe and comfortable environment, and never would be out driving or working after consuming anything containing THC. So the raw flower, this is a picture of what it could look like, and it can be all different colors. It can have purple hues to it. It can have different greens and yellows and oranges. The orange hairs that you see on there, that's what contains THC. So there's sticky trichomes on the flower that are very heavily concentrated with THC, THCA technically, until it's burned or vaporized. And what I mean by that is patients may burn the flower in a bowl, in a joint, in a water pipe. That is traditionally how it's been done for 10,000 years. But there's newer devices out there that can actually heat the flower without getting to the point of combustion. The benefit to this is it's a much lower temperature threshold to release THC in its active form to be inhaled. And it also prevents a lot of the plant material being inhaled that isn't providing any medical relief. The advantages of this is it's very fast. So inhalation is the quickest way to feel the effects of cannabis. Within minutes, someone can feel what it's going to do to them. And usually within 1 to 3 hours, the effects wear off. So it doesn't last for very long. So for someone who's looking to fall asleep, for example, this can be beneficial because it can help them fall asleep, but then it will not be felt when they're waking up. If someone's looking for very quick anxiety relief, if they're having a panic attack, or if they're in extreme pain and need quick pain relief, this would be the route of administration to provide the quickest symptom relief. On the bottom right is an example of a vape oil. And similar to the way that flour can be vaporized, these extracted oils can be vaporized. The difference between this and the plant is the potency. So flour may have somewhere between 20 to 30% THC by weight, whereas a vape oil like this can be upwards of 90% THC, much more potent. But that means within a couple puffs or inhalations, someone may be able to get their symptom relief, and it is much less odorous, and it is honestly much less messy than dealing with the raw flower. But still, raw flower is the most popular product type sold across the country, and probably will be until certain categories such as drinkables and different edibles such as gummies that are becoming more popular are produced. Something that's digested is the opposite of inhalation in the way that to the different CB1 and CB2 receptors, because it has to go through the liver first, there's a huge delay in onset, sometimes up to 2 hours before someone feels the effects. So this is why if anyone's ever had an edible and didn't feel anything, so they take another one and don't feel anything, and then all of a sudden it hits you like a brick wall, it's because of this delayed onset called first pass metabolism. And once a product is ingested, delta-9 THC is converted to 11-hydroxy THC, which is a more potent agonist at the CB1 receptor, has a longer half-life. So the effects feel stronger than smoking and last way longer, sometimes up to 8 hours. So for our patients who say, I fall asleep, but then I wake up all through the night because I'm just in pain, this is a type of product that may be used to try to help get them all the way through the night without the effects wearing off. But there's always that chance of the morning grogginess, which is why a lower dosage is recommended to start with and slowly build up. We have traditional capsules, tablets, chewable mints that are great for patients who are new to cannabis because they can take a measured amount of THC and know exactly how much is being consumed. Contrary to inhalation, where it's really impossible to calculate how much is being absorbed at any point in time. A microdose of THC would be considered somewhere between 2.5 to 5, 10 milligrams at most of THC. 5 to 10 milligrams, we say, is an appropriate place for people starting, but everybody's different. We have some patients who take 200 milligram capsules of THC, and it's really dependent on each individual's metabolism and tolerance. And that's a big disadvantage, is just some people, they don't feel the effects of orally consumed products. And it's not necessarily the dosage, it just can be due to their individual metabolism. Products that go under the tongue are, we call an in-between, between inhalation and ingestion. They can typically take effect within about 20 to 30 minutes and last up to 4 to 6 hours. So takes a little bit longer than inhalation, but lasts much longer. Most of our products are oil-based oral solutions that you'd use a dropper under the tongue. And we do have a few alcohol-based oral sprays like this. They use 95% ethanol to highly concentrate the product. And so this can provide something like 5 to 7 milligrams of THC in a single spray. So it can be convenient for people who are looking for something to bring with them on the go. But a huge disadvantage is patients say anything alcohol-based tends to have a very strong burning sensation and can be really uncomfortable under the tongue. We have a lot of patients who, in our initial conversation, we ask about inhalation and they want to skip right over it. It's not going to be for them. This would be the next product type that we would talk about to try to get the quickest symptom relief possible. And this is also the product category where we find the most balanced products of CBD and THC. So we can work with different ratios, such as 1-to-1, 3-to-1, sometimes up to 11-to-1, part CBD to part THC to try to achieve that symptom relief without psychoactive effects. Topical is definitely the least popular category. It's something that has more of an unpredictable onset and offset. So patients can really apply them as needed to the affected area, such as a joint, a muscle. Some of our migraine patients find that during a migraine, it can be applied to the temples and the back of the neck and provide migraine relief topically without psychoactive effects. And we have some products that are scented, unscented, but this isn't something where there's a huge amount of products that we have available to even acquire from the licensed producers. There are certainly mental health considerations with cannabis. Like I said in the beginning, THC is very strong. It can have some very serious side effects, anxiety, paranoia, increased sedation. So this is a conversation, especially with our patients who are coming to us with existing mental health diagnoses, and how cannabis can worsen their existing mental health. So if they're on certain medications that can interact with cannabis, and these are all very much hypothetical interactions because it's federally legal. We don't have a lot of true studies on how the cannabis plant interacts with medication. It's mostly hypothetical with using something like dronabinol or marinol, which is a synthetic Delta-9 THC, and Epidiolex, which is an FDA-approved CBD product that's only approved for epilepsy. We extrapolate some of this information to try to figure out whether it's hepatic induction or inhibition, how it may affect the metabolism of other medications people are taking for their condition. This was one study that I pulled that I thought was really interesting. So it looked at patients with heroin use disorder specifically, who had been abstinent from heroin for at least 1 month, and exposed them to cues. And either they were dosed with placebo, 400 milligrams sublingual CBD, they used Epidiolex for this study, or 800 milligrams once a day for 3 days. They measured points such as cravings and anxiety, which were measured with scales, and also heart rate, cortisol, to see how the body was reacting to these cues, whether they're on placebo or CBD. And there was a significant decrease in the cravings and anxiety with either of these dosages. Between the two dosages, there wasn't a significant difference. So it appears that 400 milligrams is as effective as 800 milligrams. And this had a prolonged effect. So a week after, even when the CBD was no longer present in any significant amount in the bloodstream, they were still having symptom relief and were able to have less of a physical response to cues. The first set of cues was a video. So they either saw some for baseline, they would either do a relaxing video, or after that, a video of someone using a drug intravenously or intranasally. And about 3/4 of these patients reported that intranasal was their preferred route of heroin administration. And then they either were given placebo or CBD at different timing with the four visits. And on the next visit, they were either shown just objects that had nothing to do with heroin, or they were showed paraphernalia that was associated with heroin, or even the drug itself, or a white powder in a bag. So there was surveys done at different points in time, and also they are provided mental health support to make sure that they weren't going through this and then having negative outcomes due to the study itself. And there's 42 participants and data that was used to complete this study. As of July of last year, cannabis became legal in Connecticut. And what this means is that any adult 21 and older can legally possess and consume marijuana. This does not apply to retail sales. There's no legal adult use sales happening in Connecticut. So when you see those billboards on 84, 91 for cannabis dispensaries in Massachusetts, that type of market is what will eventually become likely later this year. But right now, only medical marijuana patients can purchase cannabis from a store. Someone can acquire cannabis from another individual through a gifting process, but there can't be any exchange of currency for that gift. There was something that was happening where there were events where people were setting up tables and accepting quote unquote donations for cannabis, and they would give one person and another person would hand them product in return. That has since been reworded in the legislation that gifting has to be between acquaintances. So there won't be these large marketplaces where people are gifting cannabis to anyone coming through the market. The medical dispensaries will be the first to provide adult use sales, and it has to be co-located, meaning that under the same roof, we'll have sales happening and medical sales happening. Medical patients will have access to lower price points. There'll be no tax, whereas adult use will have a 23% tax, 3% of that going to the local municipality, 20% going back into the state, with some of that going back out into programs to help populations affected by the war on drugs and affected by people who've been incarcerated. So there'll be support programs and money going back to help people who've been impacted by all this. And public consumption is limited. So it's not like someone can legally walk around consuming this. Large cities actually are going to have to provide a legal area for public consumption. So bigger towns, West Hartford, Meriden, I don't remember if Manchester is in there, but we'll have to have a space available for people to consume outside. These are some resources that I recommend for learning more. Cannabis pharmacy is how I like to say I learned about 80% of what I needed to get going on this job 2.5 years ago. Because there isn't a lot of evidence-based medicine or really true clinical literature, this was something that was recommended to me and is a nice, very easy read background on the history of cannabis, on the anatomy of the plant, what the effects of certain strains can be, what types of products are recommended for different health conditions. So for any practitioner who's looking to just dip their toes in a little bit in an approachable way, I recommend this book. TRX Magazine is a free resource online. It has a nice clinical touch to it on what information is out there on the plant and the industry. And then the Journal of Endocannabinoid Medicine hasn't really grown all that much. There's only a few issues, but it is, I would say, the most science-based of these resources. I didn't see any questions in the chat box along the way. And this is just the state's website with helpful information about the program and statistics if you're ever looking for any. But I'd love to answer your questions now, whether it's through the chat box or if you'd like to unmute yourself. We would love to answer any questions you might have.
Yeah, Eric, I was just curious about any of the hurdles that you guys may have had to overcome in building new sites. Kind of, I know
Yeah.
you had a slide talking about it, but kind of what goes into that, and
Yeah.
is it's probably not a simple process.
No, so because it's federally legal, you're really limited in what sort of resources you can connect with. So you can't take out a typical loan from a bank. You can't do banking services with any federally FDIC backed bank. You can't take out a typical, you can't form a typical rental agreement with the building because of the same federal illegal status. So our company, I know they've purchased real estate. Just getting the license in the first place is a very long process. The round that we went through in 2018, there's, I believe, 76 applicants for 6 licenses, and this, 9 licenses, and the state ranked them all based off of certain criteria. And they're like 800-page applications. So you're working with a consulting company to put a full business plan together. They want to see that you've received local zoning approval, that you have security plans in place, personnel plans in place, standard operating procedures in place, all just to acquire and be approved for license from the state of Connecticut. So we can't have typical financial vendors in dispensary. We're a cash-only business. So that is something that's very different from a typical small business who could use something like Square or any debit or chip card reader. We have ATMs in our facility, and other than that, that cash at the register is the only way that our patients can pay for their products. And it's not covered by insurance, it's all out of pocket. So we do have programs in place for people who are in financial need to assist them in lowering the cost of these products. But it is absolutely can get very expensive for our patients. And the price points in Connecticut are luckily lower than neighboring markets like Massachusetts. And we have a broader product availability just because of the way the regulations are written than other states. But it's still certainly cost prohibitive for a lot of people because they can't use Husky or Medicaid or Medicare, any sort of insurance benefit. I see a couple questions coming in here. Looks like someone got the website there. Thank you. Do you know that? Oh yeah, so this is actually just answered. So in our dispensary, and this is something that isn't state regulated, every company decides how they want to do it. We have something called the compassionate need program. So if someone's at 200% or below of the federal poverty level, we offer discounted products, and they can also purchase the product for $1 once a month. And so this is something that we ask patients to bring in just proof of income, whether that be showing current Husky benefits, a tax return. We're extremely flexible about how our patients show us that they need this help. And then we approve it on the spot, and they're able to take advantage of that discount. And just once a year, we ask them to show us their proof of income again and renew them into the program. And if someone is having trouble even affording to get the card in the first place, have them reach out to our dispensaries. We can recommend providers in the area, and we have an idea of different price points of visits. And we don't want that to be the thing holding someone back from, if they're already consuming cannabis from the street, to be honest, that can be much more dangerous, laced with fentanyl. You really don't know what you're getting. We want to help those patients get access to a medical marijuana card. Would a potential patient need to have a qualified diagnosis from a PCP prior to seeing a medical marijuana prescriber? Yes, the only would be PTSD, because the medical marijuana provider can do a PTSD evaluation and certify the patient, but any other type of medical diagnosis, they would need to have prior documentation for. And some prescribers will not do the PTSD evaluation. They want you to have that already documented, but there are some businesses out there that do it all as one visit, the evaluation and the certification. Great questions, everyone. I'm just going to read this question from Gina. Yep. So I don't really know any statistics about those who go through initial assessment and are rejected. Honestly, the only diagnosis I've talked to providers about is PTSD because of that evaluation. And they say for the most part, patients who get to the point of pursuing their card are eligible under that diagnosis. But I don't really know the rates that they would of people who are found not eligible. Someone's card can be revoked. So we've had patients who were caught by law enforcement providing their product to other people. And even with the gifting law, medical marijuana is still like a prescription drug. It cannot be shared with anyone else, even another medical marijuana patient. We've had patients due to security issues at the dispensary having their card revoked based off their interactions with staff and making unsafe environments for staff and other patients. And so there absolutely is a pathway to have cards revoked if that's necessary. I'm going to read Kevin's question here. How do you feel the opening of adult use will affect the supply for marijuana patients? And then, yep, we did apply for a adult use location in Manchester. So I think the state is doing right by med patients by hopefully taking away that $100 fee, by not having them have any taxes applied to their products. There is potency limits on adult use products, such as vape oils that I referred to can be no stronger than 60% THC. So there's going to be, we have a large supply of patients who rely on vaping as their primary form of medication. They would need to keep their medical marijuana card to have access to products that are potent enough to provide them symptom relief. Also, we will have, in every dispensary, we'll have separate check-in pathways for an adult use patient for a medical patient. And it'll be much faster to come in and shop and leave as a medical patient than adult use. So there'll be financial incentives due to price point, as well as operational incentives, getting in and out a bit quicker, having access to us pharmacists all the time on the medical side. I presume the medical patient population may drop at some point, and maybe hopefully not significantly, because I believe people will see the benefits for keeping their card. So we applied for that location in Manchester, and that is something that would not have any pharmacist presence. It would be adult use only, because part of the licensing process is you can either have a hybrid facility where there are always pharmacists present, even if medical sales aren't happening, or you can have an only adult use dispensary that can be run by anyone. There's no healthcare provider required, but there'll be a different product offering than what you'd find at a medical dispensary. Great question, Kevin.
I just had a quick question. Sorry, my printer. When PTSD was added to the list for medical marijuana, was that a shift in thinking? Was that from like a FDA approval, or were there like?
No, so that was just considered, so that cancer, glaucoma, is more one of the, I'd say, legacy qualifying conditions that's been seen across the country as these medical marijuana programs stand up. I believe it's New Hampshire, for example, has anxiety, if not also depression, on their own as a qualifying condition. Connecticut didn't go to that length. They only want to keep it to that specific PTSD population, but it doesn't have to do with the FDA. There's isn't any federal government oversight on any of these programs because of the legal status of it.
Mm-hmm. That's just interesting to see, like, maybe how medical marijuana could help, opiate use disorder, like our patients in particular.
Yeah. Absolutely, and if they have a dual diagnosis with PTSD, those specific patients would be eligible. Unfortunately, that is the only route to a card at this time. Opioid use disorder on its own is not a qualifying condition. But this is why this is all very interesting, because when this goes adult use, these are people who may start to pick up products, but not necessarily with the advice of a pharmacist, and
Mm-hmm.
try to use them for managing their symptoms.
Yeah, that's interesting, because then you could also ask questions like, do you use marijuana? Does it reduce your craving?
Yep, absolutely.
Urine test surveys. Yeah, interesting.
Totally.
Thank you.
Gina, you're welcome. Gina asked a question here. If someone's assessed for a DUI by the police when they're medical, how is someone assessed for a DUI by the police when they're a medical marijuana patient? And I'm assuming you're referring to driving under the influence of cannabis specifically. So there is no breathalyzer test for cannabis. Even a blood result showing a level of THC can't be directly correlated with a level of intoxication. So this is something that makes it very tricky to do a DUI test on a patient, excuse me, on someone operating a vehicle and pulled over. So there's some companies out there that are trying to bring to market a quote unquote breathalyzer, but because of how how THC specifically interacts with the endocannabinoid system, it doesn't have a very clear relationship like alcohol does with intoxication and the effects of operating a motor vehicle. So that's something that states like Vermont, for example, were really hesitant to roll out their adult use program because law enforcement wanted a tool in hand to be able to know if someone was pulled over, whether or not they were safe to continue to drive. A standard sobriety test does not work in the way that cannabis affects the senses. They may pass a alcohol sobriety test, but indeed be too intoxicated in different ways to operate that motor vehicle. So really, really tricky gray area. Methadone clinics and patients have tension and historically in some locations still around injecting medication and being able to operate a vehicle. So smelling like cannabis isn't enough to pull someone over or to have them get out of their vehicle. Especially like if someone is smoking CBD only flower, which yes, is not common, but is possible, it would smell the exact same as if they were smoking a THC dominant strain. So the smell alone isn't enough to take the next steps of legal action. Do you know when there's a meeting committee discussion about what conditions should be added? So patients can write in at any point in time to the Department of Consumer Protection and provide testimony about why they think a condition should be added, but I don't know when the next meeting of the Board of Physicians is, to be honest. Do you have brochures available for patients? So the best way to get information about the program itself is that state website, the DCP website. So if you search DCP medical marijuana program, you'll get a great amount of information about the qualifying conditions. There's information for providers there. In terms of information about cannabis for patients, we're extremely limited as a company, and this goes for every dispensary company in Connecticut about what we can put on our website because of marketing guidelines that the state put in place. And this is a good thing to protect misinformation from being put out there. And because there isn't a lot of evidence-based information around cannabis, we are only putting very general information on our website about these products. In our menu, for example, if you click on anything on our website, it not going to tell you what it can be used for. It's not going to tell you how to use it. It's just going to tell you the lab testing information that's provided on the label. So unfortunately, we don't have a lot of printed literature or online literature provided by us, but there's websites just as Leafly, which I'll type into the chat box here, which is more, I'd say, recreational focused website, but still has some helpful articles about the basics of cannabis and the cannabis industry and cannabis products. And that sort of the resource is likely more helpful than our website in learning a ton about the plant and how it's used. But still visit our website. We have some stuff there about terpenes and cannabinoids and about us as a company. But you won't find a ton of really deep down detailed information like you will on a website like Leafly.
All right, well, Dr. Halpern, thank you so much. That was really informative. And I think, if anyone has further questions, we have your information and we have your presentation recorded. So thank you very much for everything. And
You're welcome.
Any last comments? Otherwise, we'll let everybody get on with their day.
I really appreciate this opportunity. And I love getting in front of a group like you who hasn't necessarily been exposed to this type of information and being able to connect like this. always open to have this discussion. My email's there. Feel free to pass it along to colleagues, patients alike. Always just trying to spread good information about this program and about what cannabis can do, and honestly try to break down some of those stigmas and myths that are out there. A lot that I had just from my upbringing and how my family viewed cannabis as a young adult, and myself going through college. So I'm always happy to help people learn about this.
All right. Thanks, Dr. Halpern.
You're welcome. Have a great day, everybody.
Take care.
Bye-bye.